we are going to talk about neurocognitive disorders. This is based on the DSM-5 TR. This topic helps us understand conditions that affect how people think, remember, and make decisions. This is what we often call dementia in older terms. So, what are neurocognitive disorders or NCD? These are brain based conditions where a person experiences a decline in mental abilities such as memory, attention, and problem solving. The key term here is decline, meaning they used to function normally, but something changed. Again, from normal and then something changed. Unlike developmental conditions, these are acquired later in life, often due to aging, illness, or injury. Again, key term here is a decline. There are many causes of NCDs. For example, Alzheimer's disease, it's actually most common, causing gradual memory loss. Vascular NCD occurs after strokes. Lewy body and Parkinson's disease types often include movement issues. We also need NCDs we also see NCDs that are caused by traumatic brain injury, HIV infection, substance use, or genetic diseases like Huntington's. So, not all NCDs are related to old age. Even younger individuals can develop them. Key characteristics of NCD. What makes NCDs unique is that they involve cognitive decline. Okay, again, they involve cognitive decline. It is a noticeable drop in thinking ability. Okay, but it is not due to another psychiatric disorder like schizophrenia. They are acquired, meaning from a normal stage, they have acquired it and not present since childhood. The decline affects independence, work, and relationship. There is impairment. Okay, let's differentiate between major and mild NCD or neurocognitive disorder. Major NCD involves significant decline and loss of independence. For example, a person may forget how to manage money or cook. Mild NCD involves modest decline, but the person can still live independently, though they may need reminders or extra effort to do daily tasks. So in the daily functioning, okay, so the daily functioning, they might need to help to be helped in terms of daily activities. They cannot eat alone. Okay, they cannot go to the comfort room alone. They cannot dispose their urine alone. Okay, so mild is they are still independent but declines with complicated or struggles with complex tasks. Okay, so in terms of awareness, major people with major NCD are often unaware of what's happening around, while with mild NCD, they are often aware of changes. So, just like, okay. The DSM-5 TR replaced the name dementia with neurocognitive disorder. Why? Because dementia sounds limited to the elderly. The newer term covers both older and younger adults, like those with brain injury or infections. Another key change is that DSM-5 TR allows diagnosis of major NCD even if only one domain is affected, while older manuals require multiple deficits. Probably you're familiar with MMSE or mini mental status exam. Okay. So here's a chart linking severity, function, and MMSE scores. Severe, major, and CD, they are fully dependent in all activities. Okay? So their score is less than 10. Okay? So moderate, major, and CD, they have impairment in terms of basic daily activities like bathing, dressing. So their scores are ranging from 10 to 18. While if they have mild NCD, the impaired instrumental skills like managing money or cooking is like that. So MMSE is around 19 to 26. I will explain basic and instrumental ADLs later on. Okay, while mild NCD, they have no impaired activities, only subtle cognitive changes. Okay, we can also specify if there's a behavioral disturbance like mood swings, agitation, or apathy. So to remember the two types of daily activities affected, you can use these mnemonics. So basic ADLs, wet the bed or walking, elimination or continence, toileting, grooming, bathing, eating, and dressing. They have difficulty for those. Instrumental, depend, is the mnemonic, like dollars, environment, phone, like eating, nursing, and driving. These involve managing independence in the community, again, when dealing with other people. When diagnosing NCDs, clinicians assess 6 key domains. So first, complex attention, executive functioning, learning and memory, language, perceptual motor function, social cognition. Each domain tells us which area of thinking is affected and how severe the impact is. In complex attention, people have trouble focusing, especially in noisy environments. They can't do two things at once and get easily distracted. Even with mild cases, they take longer to finish tasks. To test this, psychologists use reaction time or number recall tasks. Example, I will tell you a series of numbers. Please repeat it to me as how I said it to you. Example, I would say 1743. Okay, your turn. You should be able to memorize and repeat those sentences. Next, executive functioning. Okay, this domain covers planning, uh, with, going back. So the reaction time is how well your stimulus response is. Example, you would be told to do the number 1743. And then when the uh, administrator would say, okay, I would say a number and you need to repeat it. If you would take time, like a minute before you can execute it, there must be a problem with your reaction time. So, executive functioning or function covers planning, organization, and decision making. Some with major impairment may abandon tasks or forget steps in a recipe. Those with mild impairment can still plan but get tired easily. Assessment involves problem solving or sequencing tasks, for example, like arranging objects logically. Memory loss is the hallmark of NCD. People with major impairment forget entire conversation or repeat questions. In mild cases, they just rely more on reminders or notes. Memory tests include, or you can do an assessment using memory test. It does include recalling stories or recognizing diagrams after a few minutes. This domain assesses how we use and understand words. This is language. So major impairment, they will have difficulty naming objects, using vague terms like that thing, kana ba, kato ba. Mild impairment would be having occasional word finding issues. Tests involve naming pictures, explaining meanings, or following commands. Perceptual motor functioning is the area which involves movement, coordination, and spatial awareness. Sa mga driving, dressing, buttoning your shirt. A person with major NCD may get lost while driving or have trouble dressing. Mild cases may simply take longer to find their way. So tests involve drawing shapes or recognizing faces. Social condition or cognition, this domain looks at how well a person understands social cues. In major cases, they might act inappropriately or show poor judgment. Mild cases subtle changes in empathy or personality. Assessments include emotion recognition tests or theory of mind task, like interpreting what others feel in stories. To diagnose NCD, clinicians look for clear decline in one or more cognitive domains. They use interviews, family reports, and neuropsychological tests. It must not be due to delirium or another mental disorder. And the cause like Alzheimer's or brain injury must be specific. Why early detection is key. It actually helps with treatment, planning, safety, and emotional support. Family members can prepare and manage risk like wandering or medical errors. Early intervention also slows decline through brain exercises and therapy. So to summarize, neurocognitive disorders involve decline in memory, reasoning, and daily functioning. DSM-5-TR broadened the term to include more causes beyond dementia. Severity de- Severity depends on how much the person's independence is affected. And remember, wet the bed and depend. Okay, basic ADLs and the others. So our quick guide for understanding ADL impairments. Okay. So I will cut the video in here. I hope you've learned something based on the introduction. See you next time.